Limpopo Health is embarking on a malaria campaign with the theme Zero Malaria Starts With Me. MEC Dr. Phophi Ramathuba will lead a campaign at Mapungubwe National Park. The MEC for Health in Limpopo joins us now for the very latest in terms of this particular campaign. Thank you very much, ma'am, for your time this afternoon. Maybe let's start with an outlook in terms of the province and malaria, the relationship between the two. How much of it is it a problem?
Good afternoon to you and afternoon to all your viewers out there. Limpopo province, it's one of the three provinces in South Africa which have historically been known of being a malaria endemic. If you zoom in into our province, two of our districts, Vembe and Mupane, are the ones that are known to be a high risk in terms of malaria. And the other three districts, which is Kukune, Capricorn, and Waterberg, have not been known to be malaria endemic. But in the past years, we started to see re-emergence of malaria in those particular districts that have never been malaria endemic districts. But then through our program, since we started, if I remember, 2017-18 financial year, we had a very devastating situation where we registered 18,977 malaria positive cases. And of those, unfortunately, 160 died. We worked on a program that was able to assist in terms of a reduction of malaria cases, moving towards eliminating malaria completely. As we speak, this past financial year, which ended in March, we were able to reduce and come down to just 1,700 cases of malaria, and of those, unfortunately, we lost 24. But if you look where we are coming from, on an annual basis, we've been seeing reduction of cases. Then we therefore declare to say zero malaria begins with an individual, and that is where this campaign has started. And we are now focusing to say those districts which were never known to be malaria endemic, we need to go back to their original status and focus and put more resources on them, so that while we are reducing new cases or cases in the other two districts, we don't find ourselves having to start dealing with new cases in those districts that never had cases. But as it is for now, the programs that we've put in place, especially if you look at the preventative, wherein we put in those cadres that we appoint on a seasonal base to come and do indoor residual household spraying. As it is for now, we have already by now sprayed more than 1.2 million households in the province. And not only that, we are planning to increase from the 430 that we have our sprayers. We have now increased the number to, it's going to be 600, so that we can reach out to as many. And what is important is public education, teaching individuals to understand that when you stay in the malaria endemic area, how can you protect yourself, avoiding putting water in small buckets across the household, when you clean or mop or using the cow mud to like we do in our rural areas, in our villages. You have to make sure that you throw away the water that has been used, and you don't leave, because that becomes an incubator for the mosquito, because the female mosquito called Anopheles, it's very dangerous in terms of when it comes to its spreading of malaria. We're also working with the schools, because we have noted, even during COVID, that once you teach the learners at school, you are teaching the entire family. Once you teach the kids to understand what are the symptoms of malaria, which are not different from COVID, it has assisted, because some parents, when I meet them in the mall, they will be telling me that, oh, my daughter was telling me about signs and symptoms of malaria. She heard the MEC talking on the radio that when you have a headache, when you have fever, some people even vomit, some will just be having general body ache. You must know that you might be having malaria. We have also capacitated our clinics to make sure that every clinic must have treatment, it must have test kits. We are also, in terms of assisting capacity and resources, getting our environmental health practitioners who are now trained to can screen and test malaria and initiate the treatment. These are mainly, you will find them even at the border post. You find them within the communities. Some of them you find them within our municipalities. So we have seen that also working. It is out of this work that we have seen us having to go down in terms of reduction of the new cases and also reduction of numbers of fatalities as a result of malaria.
There's no greater accountability partner than the young ones. But those 3 districts that were not endemic where malaria is concerned, why is it that we're finding they are now?
What we have noted, for instance, if you look at Waterberg district, we saw an outbreak of malaria in the past years in Botswana. And Waterberg district, that is through even Lephalale River, which is around, it is bordering South Africa and Botswana. So that also has contributed in us finding increased number of malaria cases around the Lephalale area. Hence, we had to really zoom in and start educating the community around that area, because we were able to test some of according to our team, our malaria response team, around the Lephalale River. That is where we have seen a lot of brewing and the re-emergence of these Anopheles mosquitoes, and hence we have seen the cases. If you go to Sekhukhune area, we have what we call taxi malaria or paper bag. There's a lot of mines within the Sekhukhune. The same applies in Waterberg. We have got a number of migrant workers who originally reside in other areas, parts. For instance, some are coming from as far as Mozambique, some are coming from as far as Zimbabwe, some are coming from as far as Mopani and the Vembe district, some from KZN parts where Mpumalanga, Sekhukhune also a border with Mpumalanga. They come to work in those particular mines. So when I talk about paper bag or taxi mosquito, some of them carry these mosquitoes within their luggage as they will be coming. And then when they come here, that's because we found the outbreak within a hostel. So these are other areas that we target to say, if you are visiting a malaria endemic, irrespective of whether it's your home or that you are coming for holiday, you do during holiday, you want to visit Kruger National Park, you must remain vigilant. When you get here, try to use the mosquito coils, try to use the ointment that are mosquito repellent, try to use the alcohol in your hotel. But also what is important, try to also get malaria prophylaxis. If all that fails, when you go home, try to observe yourself within 7 to 14 days. If you start to feel these symptoms of your headache and whatever, when you quickly visit your doctor, try to explain to your doctor. Let's say you come from Western Cape. Most of the GPs in Western Cape do not deal with malaria. And unfortunately, when you go and you don't tell them, I have visited Kruger National Park, and you have got headache, you've got fever, they might start by doing lumbar puncture, thinking you've got meningitis, ruling out all the diseases that are common within that particular area, forgetting that it could be malaria. And unfortunately with malaria, if within 24 hours there's no medical intervention, we might lose your life. So hence we're saying this particular 3 districts could be as a result of visitors, as a result of migrant workers, as a result, because unfortunately diseases do not know boundaries. Mosquitoes cannot be told that this is a border gate, you must have a passport to cross. Mosquitoes will cross and they will go and infect even the other people, because those mosquitoes in the paper bag, after biting you, they go and bite other people, and then you find that within a short space of time, the malaria has spread in that particular area.
MEC Ramathuba, you mentioned that there's some 1.2 million households that have already been sprayed. One, are there more households that are going to be sprayed? And two, of these 1.2 million that you've sprayed, how much resistance did you find? And did you find that you had to explain quite extensively to residents why this is, the side effects, and what this spray essentially does, and it's not harmful to people's lives?
Dudu, we must indicate that, as I've indicated in the 2017, the year we had a high number of cases, it was as a result, I must also indicate, media did not assist us at that time, because a lot of airtime was given to professors who have never stayed in a malaria endemic, talking negative about the chemicals that we use, and without even having to look at the facts, what does the WHO says, what chemicals have been registered and are allowed to do indoor residual spraying, which ones have been banned from the agricultural use, without even looking at that information. Unfortunately, that cost us a lot, and the lives of many people that were lost. But I must also, again, once more, thank media houses, because having realized that we partner with some of your sister media space, both print and electronic, and started work to go with them to explain what these chemicals are all about. And also, we now use malaria survivors. We have got a family where they lost almost 5 or 6 members of the family during that time. And the survivors are the ones who are able to explain, to say, you know, this is quite important. And as the number of years continue, and they see, because of this spraying, we are seeing number of deaths going down. We are seeing people whose household have been sprayed, the infection rate going down. This year, last year, we saw very little resistance as compared to at the beginning, because now people are starting to see the benefit of indoor residual spraying. They are now starting to see that indeed malaria can be eliminated through this particular spraying program that we have started. So yes, there is still part of resistance there and there, but like I'm sure others are watching as you are talking to me. And when they are listening out there, they realize that yes, I should not shy away from being my household being sprayed. The other issue which assists us a lot, because as a province, being most of the more than 80% rural, our leaders are traditional leaders, and we also have got traditional healers. We also have got churches, religious leaders that people tend to believe better than they would believe to a politician speaking. So our partnership with all Mahoshi, Manduna, Botobere, our kings and our queens, we have been able to win, because there was at times where they themselves will go on radio and speak about this program of spraying. Even when we launch it, we would sometimes launch it at the traditional councils. So we will work with the House of Traditional Leaders, and we will identify villages that are very at a high risk, and we will visit the councils and work with them. We will work with the churches, and we still continue to work with those influential churches, and also our traditional healers, who we even print the manuals in terms of the protocols and guidelines on the treatment of malaria, how to identify, because when the patients visit them, we know our people. Before we could even seek health, we start by alternative care, and we also visit our traditional healers. So in our province, the relationship we have with all these stakeholders, we have seen it working, and it has yielded positive results, in the sense that we are no longer having a lot of negativity and resistance when it comes to malaria, indoor residual spraying, which is an effective way of really dealing with and eradicating malaria. So we must thank you as the media space to say your partnership with the government on this particular campaign has yielded results.
Where are we procuring these sprays from?
the National Department of Health is the one that is assisting us with all those chemicals that we procure for. You should know that South African government has declared malaria as one of its priority. Therefore, National Department of Health has also allocated a grant which is aimed at fighting malaria. These are funds that are secured and ring-fenced just to deal with malaria, so that even if you are working there as an MEC, you find that the clinic doesn't have that, you don't shift that money towards that. The money is specifically for that, and we have got contracts that are there national, which we are able to procure these chemicals through the national contracts that are out there.
Thank you so much, MEC, for your time. MEC for Health in Limpopo, Phophi Ramathuba.